Hi everyone. Today I will be discussing the study titled A Comparison of Response Costs and Differential Reinforcement of Other Behavior to Reduce Disruptive Behavior in a Preschool Classroom. The authors of this study were Conyers, Miltenberg, Mackay, Behrens, Juergens, Saylor, Hagen, and Kopp. And the purpose of the study was to compare the effectiveness of the response costs and DRO implemented on a class-wide basis of preschool children. The study consisted of 25 children in the preschool classroom, all between the ages of 4 and 5 years old. All the participants showed high levels of disruptive behaviors, which the researchers operationalized as any instance of screaming, crying, throwing objects, or using them as weapons, and also refusing to comply with the teacher's request. The observers used a 10-second interval recording system and used a tape recorder to cue the observation intervals. However, the children could not hear when the tape recorder went off. The researchers compared response costs and DRO using an ABAB alternating treatment design. The initial intervention lasted for 2 months, and after the return to baseline, the response cost treatment was observed again for another 7 months. The dependent variable in this study was the percentage of intervals with disruptive behavior, and the independent variables were the treatments of the response cost and the DRO. Inter-observer agreement was maintained by 2 observers independently recording the number of children who displayed disruptive behaviors in each interval, and then they used an interval by interval basis and calculated the percent agreement. During baseline, the mean percentage of agreement was 93%, and during intervention, it was 92%. The treatment sessions were 15 minutes, and for the response cost, the children started with 15 stars, and if any behavior occurred before the timer went off, they would lose 1 star during that time period, and they needed 12 stars to receive their reinforcement. However, for DRO, the children did not have any stars to begin, and if the behaviors did not occur before the timer went off, then they would earn a star, 1 star, during that time period, and they also needed 12 stars to receive their reinforcement. In both treatment conditions, the children were told what constituted as disruptive behavior, so they knew what should not be occurring. The results of the study was that during baseline, disruptive behaviors occurred in, on average, 64% of the intervals. However, during response cost, disruptive behavior decreased throughout the treatment to a mean of 5% of the intervals during the last 6 sessions. During the DRO treatment, disruptive behaviors were initially lower, but they increased to an average of 27% of the intervals during the last 6 sessions. When baseline was reintroduced, the disruptive behaviors rose again to an average of 52% of the intervals. And when response cost was reintroduced, the intervals maintained low rates of disruptive behavior, even with the increasing time. The conclusion of the study was that the disruptive behaviors decreased when the response cost was utilized. However, the limitations in the study were that during the response cost condition, the children also received feedback for their behavior, while they did not receive this feedback during DRO, which possibly confounds the results by not knowing whether or not the decrease in the behavior were due to the actual response cost condition or the feedback. And also, a functional assessment was never done to determine what the maintaining variables for the function of the behaviors were. All right, that was my study. Thank you.